changed with the new federal administration. I mean, it's not strictly Medicaid or Medicaid expansion at this point of what's being talked about, but still addressing that group of people that's having difficulty. A lot of it is circling around primary care programs and trying to make sure that they are investing some of what they have into that program, so it's not just a gimme, if you will.
But you understand this has a direct impact on lower income families with young children?
I do.
Okay.
I do. I wish I had an alternative. It's not something I've worked on, to be honest with you. I was against the Medicaid expansion because I've only seen it cost states multi-millions of dollars in implementing it. The federal government would only fund it so much, and then it drops off, and it actually didn't exactly address everything it said it would as far as decreasing hospital visits and things like that. So my fear was it would be taking federal monies under the guise that they're going to pay for it forever. And the big fear I had at that point last year was that we're most likely going to have a new administration, I thought, and that they would cut that off, and then we'd have this huge population we were responsible for to fund. In doing that, there would be no federal funds for it.
But that waiver expansion would have been providing Idaho the opportunity to determine how that would look, and we lost that opportunity.
Right. So others are working on this at that point. I wish I had a cleaner answer for you, and I wish it was something I had time to work on. And unfortunately, I have a circumspect understanding. I listen to others that are on that health and welfare committee to hear more of the day-to-day issue with the boots on the ground, and they're working on those issues. So what I'm hearing is that conversation is still going on, but what it's going to look like is not just a Medicaid expansion issue. But I am fearful of increasing a dependent class of people that will always look to the government for their support and sustenance. And if there's not an encouragement in there.
Can I tell you that some of the families that I work with work 2 jobs? They have children that they have a hard time feeding and clothing. They don't want to be